My name is Debbie Ogbemudia, Doctor of Cardiovascular Physiologist. Today, I'll be talking on the effect of smoking to the respiratory tract. First of all, before I talk about the effect of smoking on the respiratory tract, I want to talk about the normal architecture, the physiological makeup of the respiratory tract. You know, we breathe in oxygen and we breathe out carbon dioxide. The oxygen we breathe in, the respiratory tract, from you have the nose, the mouth, the esophagus, the trachea. The esophagus lead to the digestive system, but the trachea lead to the respiratory tract. From the trachea, you have the bronchus. From the bronchus, you have the bronchioles. Then from the bronchioles, you now have the respiratory tree. Then you now have the alveoli. Then in the alveoli, that is where the gaseous exchange, the oxygen and the carbon dioxide, that is where the exchange take place. When the pressure gradient of oxygen in the alveoli is greater than the pressure gradient of carbon dioxide in the alveoli, oxygen will enter the respiratory system, and while carbon dioxide will leave, and the blood vessel that will now convey the oxygen, the blood will become oxygenated blood because the blood has mixed with hemoglobin. The oxygen will bind to the receptor of that hemoglobin, then it will be conveyed to the body system. You know, all veins carry deoxygenated blood except pulmonary vein. The pulmonary vein will now convey the blood from the lungs to the heart, and oxygenated blood will now be supplied to the body system normally. Then equally, when the pressure gradient of carbon dioxide in the alveoli is greater than the pressure gradient of oxygen in the alveoli, carbon dioxide will now leave, that is exhalation, will now leave, and it will be expelled to the environment, which the plant will now make use of. But when you smoke, chemical substances, toxins, are being released into the respiratory tract. These are the following effects it will cause to the respiratory tract. You know, the respiratory tract, the upper part of the inner part of the respiratory tract contain what is called cilia, and the cilia is able to remove, number one, is able to remove bacteria from the respiratory tract. Then number two, the cilia is equally able to remove, that is, dust from the respiratory tract in a form of phloems. Like when you cough, that is the cough productive, those things that are productive that is coming out is called phloem. So it is the help of the cilia that those substances are able to be expelled from your respiratory tract. But when you smoke, the tar, the substance in the smoke called tar, it will now be deposited in the cilia. So when they are deposited in the cilia, so the cilia will not be able to carry out their normal function, which is one, removing of bacteria, two, removing of dust particles from the respiratory tract. Then at the same time, gradually, since the cilia is unable to perform its normal functioning, the alveoli, knowing that that is where the exchange of gaseous exchange take place, gradually the tar will now be coating the wall, because the alveoli, the cigarettes that you smoke equally release a substance known as carbon monoxide. And the carbon monoxide, the body do not tolerate carbon monoxide. That is what we call carbon monoxide poisoning. It can lead to death. It's carbon monoxide poisoning. It's very, very bad to the body. It's one of the harmful substances in cigarettes. Then the carbon monoxide, it has high affinity to bind to the hemoglobin in the alveoli. Instead of oxygen to bind to the hemoglobin in the alveoli, then the carbon monoxide will now displace oxygen, and carbon monoxide will now bind to the receptor of that hemoglobin. Then it will now be carried to the body. That will now lead to carbon monoxide poisoning. That is why it's not good. Smoking is not good to the body system. At the same time, when you smoke, nicotine is being transported through the lungs. So when it's transported through the lungs, the nicotine will now bind to the nerve cell. When it binds to the nerve cell in the brain, dopaminergic receptor is stimulated. Then the dopamine is released. When the dopamine is released, the individual will now feel okay. The individual will now feel relaxed. That is why some individuals will now have dependence on smoking. When they don't smoke, it's like they are not comfortable. They are not well. When they don't smoke, it's because of the nicotine. And the nicotine has the ability to be transported through the lungs, then bind to the nerve cell. In the nerve cell, in the brain, the dopaminergic receptor is now being stimulated with the help of that nicotine, and dopamine is released. When the dopamine is released, and the individual will not feel well, there will be wellness. And it's not really good. Then with time, the liver is able to detoxify the nicotine. Is able to detoxify it. Then the level of dopamine that was released will now equally drop. The individual will now feel the sensitivity of smoking again. You can see it will now lead to dependency. The individual will not depend. Sometimes when they eat, when they don't smoke, they are not okay. Sometimes when they want to sleep, when they don't smoke, they are not okay. It's because of this nicotine and release of dopamine in the brain that lead to all these activities. So at the same time, when you continue to smoke, the wall of the alveoli, instead of them having highly vascularized of blood, they will now be coating with that tie. They'll be coating with that tie. It will now become black. When they become black, instead of oxygen coming into the system, it's carbon monoxide that will be going into the system, which will not be good. And at the same time, it can lead to carbon monoxide poisoning. That is why Federal Ministry of Health said, and I quote, that smokers are liable to die young. So ladies and gentlemen, if you don't want to die young from smoking, which will cause cancer, which can cause cancer, which can cause dependency, you will now be depending on smoking. When you eat, you must smoke. When you want to sleep, you must smoke. Even when you want to sex, you must smoke. When you want to do anything, you must smoke. When you want to go for interview, you must smoke. You see, dependency is already there. So please, ladies and gentlemen, I will want you to stay away from smoking, because smoking is not good to your respiratory system. And at the same time, those that smoke, with time, it will make their dental, that is their teeth, will become yellowish. It will now be yellow. It will change. Instead of your dental to be white, your dental will now be yellow. Then your finger at the same time, instead of your finger to be white, your finger will now equally be what? Yellow. That is one of another effect that smoking can equally cause to the body. I remain your humble host, Edebiri Ogbemudia, your doctor of cardiovascular physiologist. Please, ladies and gentlemen, if you spoke before, I want to advise, I want to appeal. My father, my mother, my brothers and sisters, stay away from smoking, because smokers, Federal Ministry of Health said, smokers are liable to die young. Subscribe to my YouTube channel, share, comment, and like. Thank you for watching.